Hello everyone, today we are going to learn about xylazine and wound care. After this presentation, you should be able to explain how xylazine creates wounds separate from the injection site, assess the severity of wounds, and understand the stigma around substance use. Before we get into wound care, we need to learn more about what xylazine is. It was discovered in 1962 by Bayer and was originally promoted as an antihypertensive. It works as an agonist on alpha-2 adrenergic receptors, which are found throughout the body. In the brain, they work on sympathetic outflow and can cause CNS depression. In the periphery, they are used to control sympathetic tone and blood flow, which can cause hypotension. Because of these severe side effects of CNS depression and hypotension, it is not approved for human use by the FDA and was later introduced as a sedative and analgesic for veterinary use. Today, xylazine is only intended for use in animals like horses, deer, elk, cats, and dogs. It is used as a sedative, analgesic, and an anesthetic. When used for horses, the IV dose is 0.5 milligrams per pound, and when used intramuscular, it is 1 milligram per pound. The average weight of a horse is 900 to 1200 pounds. This would make the IV dose between 450 to 600 milligrams, and the intramuscular dose between 900 and 1200 milligrams. The onset of action is different depending on the route of administration. If used IV, the onset is 3 to 5 minutes, and if used intramuscular, the onset is 10 to 15 minutes. Some side effects include slower heart rate, change in heart rhythm, and moderate loss of coordination. Xylazine can have additive effects when combined with other tranquilizers and anesthetic drugs like ketamine and diazepam. Overdose in horses can cause heart arrhythmias, low blood pressure, and respiratory and CNS depression. Remember, all the information just reviewed is only for animals and not humans. Illicit drugs can also be known as recreational drugs and are often used to experience euphoria or the feeling of being high. Some common recreational drugs are heroin, cocaine, methamphetamine, and prescription opioids. Adulterants are commonplace in this group of drugs. Adulteration is the act of secretly mixing in substances that are not supposed to be in the formula. Today, there are hundreds, if not thousands, of adulterants that are added to these illicit substances for reasons like decreasing the manufacture cost, increasing profit, and prolonging the high. Some of these adulterants include caffeine, lidocaine, acetaminophen, lead, and of course, xylazine. Xylazine can go by many names, but it can also go by trank, trank dope, sleep cut, and anestesia de caballo, which means horse anesthetic. Xylazine and other adulterants can be added to street drugs without the knowledge of users. When combined with opioids and fentanyl, it enhances the risk of respiratory distress, overdose, and death. Xylazine has been known to be ingested orally, inhaled, smoked, and injected into the muscle or vein. Since xylazine is not an opioid and does not work on opioid receptors, naloxone is ineffective and there is no antidote that is approved for human use. If an opioid overdose is suspected, always use naloxone. It may not be effective against xylazine, but if opioids are involved, it can decrease the effect of opioids and further respiratory or CNS depression. Since we are discussing a topic that involves multiple drugs and medications, let's review the national opioid use history that was updated in 2022. From 2000 to 2006, the illicit substance most misused was cocaine. From 2007 to 2013, it was prescription opioids. From 2014 to 2015, it was heroin. And from 2016 to the present, it has been fentanyl and polysubstance use. There has been a high prevalence of xylazine found in fentanyl-positive urine samples, up to 78% in Puerto Rico and Philadelphia. In Philadelphia, from 2010 to 2015, less than 2% of fentanyl and heroin contained xylazine. This has increased to 31% by 2019. Now that we've reviewed national opioid statistics, let's get more specific and review Michigan statistics from 2020. There were 2,011 overdose deaths due to opioids. This means that per 100,000 people, there are 20.8 deaths. 76.1% of these deaths involved synthetic opioids like fentanyl, and heroin is a factor in 31.5% of deaths. Altogether, opioids are a factor in 77.6% of all overdose deaths. We will now move into xylazine-specific statistics. Misuse of xylazine was reported in Puerto Rico in the early 2000s. The largest impact has been in the northeast of the United States, but the national scope of xylazine deaths is unknown as of 2022. And from 2015 to 2020 in Philadelphia, overdose deaths including xylazine increased from 2% to 26%. There are many differences between xylazine and opioids that I would like to focus on. Xylazine is only prescribed by veterinarians, there is no antidote approved for humans, and it is not officially a controlled substance on a national level. Opioids can be prescribed by physicians and veterinarians, can be reversed with naloxone, and are designated to Schedules 1 through 5, with Schedule 1 being the only category with no current acceptable medical use and a high potential for abuse. Now that we have a good background on opioids and xylazine, we can now learn about how xylazine creates the wounds that it is known for. Xylazine creates wounds because of the vasoconstricting effect on blood vessels that decreases skin perfusion. The other side effects like hypotension, bradycardia, and respiratory depression can also lead to lower oxygenation and perfusion of skin and tissue. These wounds can come in the form of abscesses, skin ulcer, soft tissue infections, and cellulitis. The wounds can happen irrespective of injection site because the alpha-2 receptors that xylazine works on are scattered throughout the entire body. And if a person uses xylazine for long enough, this will further decrease perfusion and impair wound healing. There are two different types of wounds, chronic and acute, and it is important to be able to distinguish between them when looking at and speaking with a patient. Chronic wounds, which are more likely with xylazine, do not heal in the normal stages and take longer than 3 months to heal. Some examples include foot ulcers and surgical wounds. Acute wounds are simpler than chronic wounds and heal in stages and in predictable amounts of time. Some examples are paper cuts and a scraped knee. This is a general overview of the many ways a person can take care of their wounds on their own. They can clean the wound and surrounding area and use ointments and dressings. Antibiotics may be necessary if there is active purulence surrounding erythema and edema. The infection status will determine if antibiotics are needed. If it is clearly uninfected, antibiotics are not needed. If you are uncertain, you can consider short-term topical antibiotics. If the wound is clearly infected, you want to use systemic antibiotics. Before we go over some of the treatment options that were just listed, I want to review this rule of thumb that is easy for caregivers and patients to remember. If the wound is wet, you want to keep it dry, and if the wound is dry, you want to keep it wet. This will ensure the proper moisture level for optimal healing while keeping bacterial growth to a minimum. Now we can dive into the specific treatment supplies that are readily available to the public at convenience stores and drugstores. When assisting someone with wounds, you want to ensure they are cleaning the area regularly with soap and water, and tap water is okay to use if it's the only thing available to them. Instruct patients to avoid rubbing alcohol and hydrogen peroxide. While it will kill harmful bacteria, it will also harm healthy tissue around the wound, which can make it harder to heal. There are also antiseptic products available like Hibiclens and iodine solutions if soap and water are not an option. Next, we will move into ointments. Hydrogels are good for dry wounds because they can be kept warm and moist. They are not great for wet wounds because they cannot absorb large amounts of fluids. These can also promote the removal of infected or necrotic tissue if it is present. Some examples are Medi-Honey and hydrogel wound dressing. Ointments are also available for keeping wounds moist, such as Calmoseptine, Tyrosol, and Vaseline. There are topical antibiotics that are widely available like bacitracin and Neosporin, but these should not be used unless you are unsure if the person has an infection and should only be used for a short amount of time. A person with chronic wounds should be changing their dressing every day or every other day at the least. Non-adherent dressings should be used on the wound so as not to disturb the healing tissue and can be held in place with medical tape or bandage wrap. Compression stockings or compression bandages can be useful since the pressure helps veins carry blood back to the heart and improves circulation. This increases blood supply and can help wounds heal faster. As to be expected with any wound, there is most likely going to be pain. If the pain is mild to moderate, over-the-counter medications like ibuprofen or acetaminophen can be used. If the pain is more moderate to severe, then the patient should see a doctor to be prescribed more intense pain medications as well as to evaluate the wound. While a person can manage their chronic wounds quite well on their own, there is a limit to how much self-care can do. You should encourage a person to seek immediate medical attention if areas of the wound are black, if the wound is foul-smelling or pus is present, fever, if it does not stop bleeding, it is very large or deep, if dirt or something is embedded in the wound, or it is too painful to successfully clean. When speaking with these patients, it is important to have a good first impression of kindness and understanding, and to continue this language throughout the interaction. Stigmatizing phrases like addict, junkie, having a clean or dirty catch, or drug abuser should not be used. These terms and phrases can perpetuate negative perceptions, and people may begin to believe these negative things others say about them, which can further delay their treatment and recovery. Instead, there are appropriate terms to use that are neutral, like person with substance use disorder, patient, use or misuse, and testing positive or negative. These terms center more on the person instead of the condition or their circumstances. Along with avoiding stigmatizing words and phrases, there is more we can do to reduce stigma around drug use. We can incorporate solutions into the conversation whenever possible. This can be in the form of suggesting donation centers for bandages and medical supplies, helplines to call in time of need, homeless shelters, and food pantries in your area. We can also show sympathy and empathy. It is such a simple thing to talk to a patient with respect and kindness and to listen to what they have to say and offer any help you can. There can also be an emphasis on effective treatments available for substance use disorders. There are medications for addiction like buprenorphine, methadone, naltrexone, Suboxone, and naloxone. There are over-the-counter treatments available as well, like bandages, cleaners, ointments, and wraps. Lastly, we want to avoid blaming the individual. While starting to use a substance could partly be of their own doing, there are also many factors to consider. There can be external factors such as unemployment and being in the wrong place at the wrong time. There could also have been an injury that led to medically recommended prescription opioids, which could have precipitated a disorder. There could also have been incorrectly prescribed medications. After all this information about opioids, xylazine, and wound care, I want to present a patient case to you. This case involves a 37-year-old female who is unhoused and living on the streets of Philadelphia City. She has a history of opiate and polysubstance use. She was enrolled in a methadone maintenance program, or MMT, where she was prescribed 80 milligrams of methadone daily but taking on an irregular basis. She has a history of multiple infections from drug use that include osteomyelitis, septic arthritis, and multiple bacteremias. She has many past treatments that were incomplete and had a tendency to leave the hospital against medical advice. Her daily use included about 8 to 10 bags of fentanyl and heroin, about 5 alprazolam bars daily, and 1 pack of cigarettes. She typically injects into the veins in her hands and sometimes her legs. It was also noted that if she missed a vein, the area would be ulcerated but would heal in a predictable manner. One day, she reported spontaneous lower extremity ulcers that gradually worsened over a few weeks. She denied injury or insect bites. I want to give a warning here because the following images are of this patient's xylazine-induced wounds. With that, we will continue on with this patient case. She had a low-grade fever of 99.8 degrees Fahrenheit, a blood pressure of 100/48, and a heart rate of 92. The wounds were present on the front of both of her lower legs. The wounds were foul-smelling and, as you can see in the pictures, had purulent drainage and significant necrosis, which is the brown and black areas of the wounds. After this visit to the methadone clinic, she was advised to visit the emergency room for ulcer management. In the emergency room, she received a CT scan, which showed osteomyelitis in the right leg and multiple abscesses on both legs. She was admitted to the hospital with broad-spectrum antibiotics, which included IV vancomycin and Zosyn. She received bedside debridement of lower extremities, topical wound care was offered and continued, and pain management and opiate withdrawal management continued. She eventually left the hospital against medical advice and continued opiate use. She was admitted to the emergency room 5 times over the next 8 weeks with similar presentations. IV antibiotics and topical wound care were resumed at each visit. During her last hospitalization, she stayed a few weeks and completed recommended treatment. She was then discharged to a recovery house where she received oral antibiotics levofloxacin and doxycycline for 8 more weeks. Her wound care regimen consisted of applying sylvadene ointment on her wounds, washing with antiseptic solution, and redressing with Xeroform ABD pads and Carelix. After everything we've learned today, why is this important? As healthcare professionals, we need to educate ourselves as well as our patients. Addiction can be hard on people. It can cause consequences that can trigger new medical conditions or worsen comorbidities. People with substance use disorder are often apprehensive to seek care because of stigma, fear of being judged, poor economic status, poor health awareness, and limited access to healthcare, to name a few. Care is often only sought out in the late stages of use because of all the factors listed just now. Addiction can also be a challenging condition to deal with, especially without support systems or interventions. There is addiction treatment available that can include medications, therapy, and assistance programs. Wound treatment and education can also be provided in an outpatient setting if these patients do not want to go to a hospital or emergency room. Along with this topic, there are also xylazine test kits available to the public. These tests can be used to determine the presence of xylazine in the substances that are purchased and can make a person more aware of what they are using. Let's review today's course. Xylazine can be used alone or in combination with other illicit drugs. Xylazine can cause devastating acute and chronic wounds that could be prevented with proper education. There are also times where you should be suspicious of xylazine use, when there is a naloxone-resistant overdose, and if there are ulcers and abscesses present, especially if they are separate from the injection site. Thank you for your time, and please use this information to educate yourself, other healthcare professionals, and patients to save lives.